Good afternoon, everyone, and welcome to the September the 8th, 2020 work session of the Salisbury City Council. We have a short agenda today, and on all three items, it will be presented by Fire Chief John Tull. So, Chief Tull, you have the floor.
Well, thank you, and good afternoon, everyone. The first item for your consideration is a proposed ordinance to approve a budget amendment to the FY 2021 grant fund to accept a grant from the Department of Justice Bureau of Justice Assistance. And this is through their FY 20 Coronavirus Emergency Supplemental Funding Program. And it is in the amount of $78,445. This funding will be used to offset expenses related to the purchase of personal protective equipment for police and fire that is required to respond to COVID-19 pandemic. So it's going to be used to stockpile PPE.
Excellent. I'll open the floor up now for comments or questions. Mr. Boda.
No, I just want to thank you guys for looking out and keeping an eye open for available grants to help us recruit some of those expenses and prepare for anything else in the future. So good job.
Thank you. Ms. Jackson?
I concur with Mayor, and I have no other comments.
Thank you. Ms. Blake?
No other comments.
Thank you. Mrs. Gregory?
No other comments.
Thank you. I take it then we have consensus to move it forward. Yes, everyone's nodding. So
yes.
Thank you very much. We have consensus for the next meeting. Chief, the second item on the agenda.
The second item is, again, an ordinance to approve a budget amendment to the FY 2021 grant fund to accept a grant from the Community Foundation of the Eastern Shore for the purchase of personal protective equipment required to respond to COVID-19 pandemic. So again, additional funds for PPE for all city departments. So we'll purchase and stockpile it for all departments.
Chief, what is the amount of that? I don't know.
Oh, I'm sorry. That is in the amount of $5,000.
Thank you very much. Questions or comments, and should we move forward? Mr. Boda.
Thank you to the Community Foundation for supporting us in this. So and I agree to move it forward.
Thank you. Ms. Jackson?
I again concur with Mayor, and we can move this forward.
Thank you. Ms. Blake?
I think it's fantastic, and please move it forward.
Thank you. Mrs. Gregory?
Move it forward. This is fantastic.
Thank you very much. And I too want to thank the Community Foundation for that grant. We'll move that forward, Ms. Nichols, for the next meeting. And the last item on the agenda is another budget amendment to accept some resources. Chief?
Yes, this is another ordinance to approve a budget amendment to the FY 2021 grant fund. And this will accept a grant from the Maryland Community Health Resources Commission. And it's for the purpose of supporting our telehealth operations through our SWIFT program. And it's in the amount of $24,799. Specifically, this funding will be used for remote patient monitoring, pharmacy and medicine reconciliation. Will help purchase iPad and tablets for telehealth visits. It will provide for mobile Wi-Fi hotspots, and it will provide some additional personal protective equipment for paramedics and the community health workers to facilitate telehealth visits. So it's the next step in our SWIFT program evolution. Now we're actually taking the doctors directly to the patients.
Fantastic. Thank you, Chief. Questions or comments, and should we move this forward? Mr. Boda.
I think the SWIFT program is an incredible program and has helped a lot of people, and absolutely support moving this forward and continuing support for this program.
Thank you. Ms. Jackson?
It is indeed an awesome contribution to the SWIFT program, and yes, we can move it forward.
Thank you. Ms. Blake?
As a social worker, this just warms my heart. And I want you to know, Chief Tull, that a lot of agencies that I work with talk highly of the SWIFT program, and that rings volumes. And I do think this telehealth in this is the next step. Congratulations to SWIFT.
Ms. Gregory?
Everybody else kind of said what I was feeling, so I think it's fantastic and move it forward.
Thank you. Chief, since I've been on the council, this is one of the highlights, I think, and one of the highlighted programs that I think has really made a difference. I know it has. Are we still seeing the reductions that we saw in the amount of frequent flyers that we used to see?
We are. It's ironic that when you take one off the frequent flyer list, someone else jumps on it.
Yeah.
But David Fippen is doing a remarkable job at managing this. Our providers, the minute they believe that there's a candidate for the SWIFT program, they're doing their referrals. So David jumps right on there, makes contact with them, and he's trying to offset any of the increase in call volume or the repetitive 911 calls. We are actually now starting to have other departments, other fire departments reach out to us, and they are looking for the potential of taking this to the next level and allowing hopefully the SWIFT program to start to have an impact in surrounding communities around Salisbury. So we're looking forward to the potential what the evolution will truly be for the SWIFT program.
Thanks again, Chief, and tell David and his crew that we really appreciate it.
Thank you.
It's a remarkable program. So we'll move that forward as well. Mrs. Nichols. Before we get to council remarks, Andy, is there anybody that has asked to comment?
No, it doesn't look like anything in the chat, and I know everybody online right now, so.
Great.
Okay.
Thank you, sir. Mr. Boda, final remarks?
Thank you, Chief Tull, for bringing these items to us tonight. Very much appreciate that and the programs that are supporting. Just, hope all the parents are happy. Some of the kids are going back to school. Some of them are still doing school at home. So I wish everybody luck in the fall, and thank you to all our teachers out there who are adapting and adjusting to this new educational situation. So just ask everybody to keep supporting our local businesses, our local restaurants, tip your waiters, tip your drivers. Thank you.
Hey, Mr. Boda. Ms. Jackson?
Just want to remind everybody to be safe, remain social distancing, wear your mask, and please sanitize. Please sanitize. Children have gone back to school. Teachers have gone back to school. Basically, everybody has gone back to their old regular agenda just about, so we just want to keep everybody safe.
Thank you, Ms. Jackson.
Mm-hmm.
Ms. Blake?
It has been a good opening for Wycomico County with the schools. Some minor glitches, but that's to be expected. So many teachers have done some really creative things online. I think many parents will be pleased with some of the virtual learning things that are going on. So it's really nice. A lot of staff support too. And just if you're healthy enough, please donate blood.
Thank you, Ms. Blake. Mrs. Gregory?
Since John is still on here, I just want to thank him very much for the professionalism of the folks of the Salisbury Fire Department. You can see I'm in the hospital right now with my son, and they came out when we called. They were so prompt and professional and wonderful and caring. And I really appreciate that. They've always been that way. And it's just, it's a huge load off of this mom's mind when I know I can make that call and know that we're going to get treated well. So that is something I just wanted to thank the team and all of the EMS workers. And I also want to thank the hospital for being so thorough and fantastic in how they've handled this COVID stuff. Getting to see it from the patient side is really eye-opening. I mean, he wasn't diagnosed with COVID, by the way. It was just aspiration pneumonia, but you know, this has been really eye-opening to see the amount of procedures that go through, you know, and the work that the nurses and doctors are doing here. So I just want to thank all of them. And just please continue to wear your masks. Please, please, please. Okay. And social distance, especially, I know college students want to get together and party. Please resist the urge, please.
Thank you, Michelle. Appreciate it. Wish the best for you, your family.
Thank you very much, Chad.
I have two things. My normal, if you're healthy, please give blood. We're still not out of the woods yet, so please do that. And the other thing that I've tried to keep up with and keep on top of, the census. If you have not registered for the census and you're on this call, as soon as this meeting is over, it takes 15 minutes tops to do it online, or you can call. Either way. Please, please, our funding from the state and feds is dependent on the results of that census. I can't tell you enough. And it's our one chance every 10 years to be able to affect what we are getting and to take better care of our people. So I appreciate if you would do that. I'm going to have a countdown from now until the end of September, and remind everybody, if they haven't done it, to please do it. So I wish everyone well, be safe, wear your mask, and take care. This meeting is adjourned.